So this is a training video prepared for the Edmonton Southside Primary Care Network for Robin Anderson. This is Luann Keenan and myself, Denise Campbell-Share, doing a mock patient role play of 5A's team assessment for obesity management. And so we're coming into the encounter assuming that I already have asked permission to discuss weight with Luann, and that this is the encounter where we're actually really going to dive into a bit more of a personalized assessment of where she's at in her story with her weight. So what I want to do just to kick things off is actually just learn a little bit about you. So as it relates to weight issues over your life, okay. You know, starting as far back as you think is relevant, and just kind of get a little bit of a story up to today. So in terms of where you've been with your weight and how that's changed over time, and sort of some of the drivers and things like that. Okay. Well, I think there's a lot of really interesting information here to explore. Mm-hmm. And I have here a list of some of your health issues that you've identified. The reason why, there's a couple things I just want to share with you. So this is our patient decision-making tool, where we just sort of go through some of this and categorize some of the strengths and challenges from your story. But first off, I think it would be useful to kind of go over this picture here. So this is our graph on patient expectations. And I think it tells a really interesting story that sort of echoes some of what you're describing to me and maybe grounds some of that. So what this picture shows is that this is a person, you know, getting engaged in terms of trying to lose weight. Mm-hmm. And so they're doing sort of standard things, and they start to lose weight. So you're pulling on a spring. Okay, so your body actually really wants to stay at the weight it's at, okay? Yeah. And when you start to do work, you're pulling on the string, pulling on the spring, pulling on the spring, pulling on the spring. And you have to push harder and harder and harder to get that incremental loss, as you articulated yourself, right? Right. And at a certain point, you will plateau. That weight will plateau, okay? And that's what I hear you describing for me. Right. What's happening in that process, though, is that you're losing both fat and fat-free mass in your body. So the fat-free mass is the part of your body that drives your metabolic rate, okay? Okay. And you're losing both of those things when you're losing weight, okay? And then you stabilize out, okay? The challenge could be that sometimes if you go to a commercial weight loss program or in your own head, yeah, you have an idea of what you want that weight to be. Right. So in your head, your goal weight in your head would be. No. Yeah, like what would be the
like
dream
when I went
weight?
back to Weight Watchers, what originally it was 140. Then it went up, then they allowed me to go up to 150, and then the max they'll let me go up to is 160.
So they're sort of setting a weight. Right. But where do you find when you're doing all this work that you're plateauing?
170.
Yeah. So your body is plateauing here. Yeah. But someone, it sounds external to you, is setting a goal that's down here. Yeah. Yeah. And we call that the expectation gap. Okay. and the issue here is that you have to work pretty hard, as you shared with me. Each time you've done this, yeah, the amount of calories that you're eating to lose that weight is reducing, right? Right. Well, the reason for that is that when you regain the weight, as you have with the yo-yoing, yeah, the fat comes back, but the fat-free mass doesn't. And so the number of calories that you burn just by doing your normal life, yeah, reduces. Oh. Your basal metabolic rate reduces. So each time a person, when you tell me that each time you have to try to restrict more and more to achieve what you did before, yeah, it's because your body's gotten much more efficient at handling the energy. and your basal metabolic rate is different. It's the amount of calories that you expend just by being, and part of that's also aging.
Yeah.
You know, and being postmenopausal and things like that, and,
Yeah.
and other elements in your body. It's not just through the yo-yoing, but yo-yoing will do that.
Okay.
Okay, and so what we call best weight is not necessarily a certain weight. It's the weight at which your body plateaus doing what you can do and maintain comfortably forever.
Mm.
So with the amount, you know, you're very active, and you're obviously very disciplined in what you eat, where your body is plateauing is your best weight.
Mm.
So in all the, you know, in all the biggest trials, usually on average, most of the population can kind of get 3 to 5% in terms of body weight reduction and sustain that.
Wow.
Right? But the idea is to never do anything you can't do forever.
Yeah.
So it has to be a permanent change
Yeah.
rather than this cyclical thing,
Yeah.
right? But I want to explore the meaning of that for you. So, you know, you've alluded to the, you know, sort of the dynamic in the household with your mom.
Yeah.
So what is it about being a certain body weight that attracts you in terms of a number?
For myself, I think it's things like getting out of the car without feeling like your legs are in the way, hitting the steering wheel, or just having more energy, I guess, to,
Okay.
or having, I'm making an assumption that my knees will feel less stressed if there's not as much weight on them.
Okay.
So I would like to have less pain in my
Okay.
knees.
So there's pain functional things that you're wanting to achieve.
Yeah.
When you consider your overall health, I mean, the amount of sport you do is a lot your whole life.
Yeah.
How would you describe your overall metabolic health?
Well, like when I had to do stairs the other day for that, so I did 5,000 stairs. I mean, my legs really hurt.
5,000 stairs.
2
And your
days
legs hurt.
later.
Yeah.
My calves were really mad at me. But I was quite surprised. I didn't do them fast. I just went plodding up and down, up and down, up and down. And I thought, I am kind of stubborn about, I just keep doing things. Like my husband talks about how he's lucky that he has somebody as strong as I am so that I can help him move the fridge. We're doing kitchen renovations.
Okay.
So I think of myself as being strong. I am really strong, and I'm,
Yeah.
but I guess when you look in the closet and you have all these clothes and you can't put them on, you think, well, I gotta get rid of those nice things. It makes me really upset, right?
Okay. So there's some physical appearance elements of it,
Yeah.
some sort of size elements of it, some pain elements of it. But as you've identified yourself, there's a lot of, you are very strong and metabolically healthy. And so what we're illustrating with this is just that when a person plateaus out at their best weight, which is what they can achieve doing a sensible, realistic, healthy diet and exercise regime, even though the weight stabilizes, lots of other things continue to improve. So, you know, as you know through sport, you can really strengthen the muscles around your knees, and you can really reduce the pain. There's things that you can do around toning and strengthening and physical fitness. That doesn't necessarily translate into weight losses. And I think I heard you say yourself that, you know, I don't lose weight with exercise. Well, that's right, you don't. People don't lose weight with exercise, right? Now, we always say fat is like real estate. It's location, 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 right? So we do know that with lots of activity like you do, you can move that fat around into more healthful places and really work on the metabolic piece. But this is just sort of to set up this expectation gap that it's not actually healthy or appropriate to calorie restrict too much to try to get down to a goal level that's not realistic, because it could actually make things worse. And that's part of what's playing into kind of some of your story of what you're articulating, I think, for me.
Yeah.
So if we look at this tool here and we just sort of categorize some of the 4M's, so these are the things, you know, it's interesting, a lot of people, as sort of you described in your story, talk a lot about weight and equate it with health, and they talk a lot about physical activity and diet. But it's actually much, much more than that. right? So the things that are challenges, which challenge our weight stability, are things that are more than just diet and exercise. And so you mentioned knee pain,
Yeah.
right? And you also mentioned that you've been a big runner over the years, and so knee pain is a challenge because it's something which prevents you from being as active.
Right.
Right. You've also marked down here, that you've had breast cancer, right?
Yeah.
And so that could be a challenge or a strength. You had breast cancer 20 years ago, and you've done well through it, and you haven't gained an enormous amount of weight since that time. Cancer tends to be a time which is sort of a high risk time.
Yeah.
But you've had resiliency and gotten through that, so we could actually even put that as potentially as a strength. I don't know, how do you feel about that?
Well, I guess one of the things when you do get breast cancer, and many people who you meet lots of people, once you have breast cancer, you find them all the other people have the same thing, and then there's this guilty feeling that breast cancer is linked to obesity, and so I caused my own cancer.
Okay.
So there's that kind of sadness that, so there's a couple of things that happened. Also, when I was running a lot, like because I had a mastectomy, I don't have two breasts. When I ran a lot and got back down to 140 pounds, I didn't have a breast on the other side really either. But when you gain weight, you have one breast that's big and one that doesn't exist. So it's like, darn it, I was back to where it was like, at least the compensation wasn't so big. That one side was sort of so lopsided in comparison to the other. So I actually thought, oh, that'll be enough motivation. I'll never gain weight again because I'll never want to be so lopsided. It didn't work. It didn't. It wasn't
Your physiology didn't cooperate with your brain. Okay. Okay. And then you had identified as well urinary incontinence, which is mechanical. Tell me about that.
Well, having two grandsons who think that I like to jump a lot, I just have to think, I am not jumping anymore, or lifting you up without kind of preparing myself, because I will have an accident.
Is that limiting the things that you're doing in terms of your activity? Okay. So
I would say yes.
So that's something we should explore too. And then asthma, tell me about that.
I've always had a bit of problem with, especially seasonal asthma, so when I'm, right now, with the gardening and stuff, it's going to get worse.
And are you educated around how to prevent it from impacting your function? Have you had an asthma action plan or something like that?
Yeah, I'm not very reliable about complying with everything, like medications. I don't like taking medications.
So that's something we could look at too, because it probably affects your function during those periods of time.
Yeah.
And so the point is that all these things that are other things affect some of the choices that you're making. And so when you've indicated that coming back from sabbatical, you're not weight stable, some of that might be playing into it, right? Other things that I see here are poor sleep, grief, stress. Tell me a little bit about that.
Well, that's harder to talk about.
Oh, sure. Well, if you don't feel comfortable, that's totally fine. You don't...
Well, my mom's 90. Well, she'll be 95 in December, but we just found out she's not going to make it to December.
Oh, I'm so sorry.
But, she's had a good long life, and she says that herself, so that's... But it does make me feel like when I come home, I'm not so enthusiastic. I just turn the TV on and think, oh, just watch Modern Family or some innocuous housing show because it's easier.
Right. Okay. And does that play into here the no time element as well?
Yeah, because I only have X number of hours, so if if they say your mom has weeks left, I'm not going to exercise.
No,
I'm going to go visit her.
Right.
But that makes me more tired.
Right. So lots of kind of grief and just sort of transitions in terms of obligations and, am I understanding correctly?
Yeah, and I have a oldest son who's probably going to move to England after is just about to defend his PhD, and my younger son is moving to Australia with my two grandsons. Oh. So we're trying to help them move, and
Yeah,
that's
so
also cuckoo.
lots of things playing into the time factor, which is a challenge.
Yeah.
Okay. In terms of some of the sort of a summary then of what I'm hearing, I'm hearing that from a pretty young age, you know, at home, just in terms of programming from mom, that there was a lot of attention paid to physical appearance and to weight, with sort of reminding and sort of having that be a sort of a basal expectation.
Yeah.
But that yourself and a couple of your siblings, but yourself, that you were a fit athlete who was very active, track and doing lots of things and strong, and so you didn't entirely conform to that sort of expectation just in terms of your physiology is what I'm hearing.
Yeah.
And so you were constantly mindful of it sort of your whole life. Pregnancy didn't present a great challenge to you. You were able to kind of get over those humps without having a lot of weight gain, but always by dint of lots and lots of physical activity. And sort of as you sort of hit 40, you had some significant challenges with increasing knee pain secondary to a lot of running, which has progressed and continues to be an issue. The being thrown for a loop with the breast cancer and having that chemo story.
And right into menopause
Then
at
right
41.
right into menopause, which hits your metabolism. So you've done that dieting thing at intervals to bring your weight down, but always requiring more and more and more calorie restriction to get down and not being able to stabilize out at that weight, sort of drifting back up.
Mm-hmm.
No history of really excessive weight gain, sort of more of a creep, but now at a level where you don't feel totally comfortable because you feel that there's elements of appearance as it relates to cancer diagnosis and as it relates to clothes and things, but also as it relates to pain and knees and things like that.
Right.
Other challenges that have emerged recently are all these time challenges, thanks for sharing, and sort of that grief and emotional piece, but all that upheaval, which is undermining your time that you have to be active, as well as a couple of these medical issues that may be contributing to things and may be causing you to restrict some activities as well.
Mm-hmm.
Does that sort of summarize things
Yeah.
pretty well, would you say?
Yeah.
Now, what I heard you say is that there's a few health things which are problematic and affecting your enjoyment of things that you might like to do.
Yeah.
So, if I might, I could make a couple of suggestions here.
Okay.
Urinary incontinence, thank you so much for sharing. You know, a third of women over 60, especially people who've had children, suffer with a certain element of urinary incontinence. There's things that we can do about that. So one of the things I might encourage you to consider would be seeing your family doctor to talk about that a little bit. And then similarly for the asthma, you know, if we manage that well, then people can go to the Olympics with asthma. Asthma should never limit a person's being able to be active. Right? So if it's well controlled, you should be able to run and row and do everything. So if it's not that well controlled, the advantage of getting it that well controlled is so that it doesn't affect your function. And again, you know, perhaps having a discussion with your family doctor, they may consider referring you to one of our respiratory therapists we have at the Primary Care Network. And they could work with you a little bit to get you an asthma action plan that works for you.
Okay.
So those are things which are contributing that might be issues. And the knee pain similarly as well, you know, I think that can be a little bit more of a multifactorial thing.
Yeah.
And so again, those are health things that I would encourage you to consider seeing your family doctor about.
Okay.
And seeing about strengthening. You're certainly doing a lot of work. Have you done any physio for your knees?
I went to there was a physiotherapist at the gym, and so she was watching me to make sure that I was making sure that I was going up and down straight and I wasn't flaring out. She gave me some exercises too. She says, your quads are too strong. I mean, I can push 550 pounds. She said, don't ever do that again. So what if you can do it? You're never going to need to kick over a bus. But you don't have equal amounts of muscle on the outside and the inside. So she is teaching me some new exercises to, like that one where you pull your legs in or you push your legs out, which I never did before. And some different things that I find ridiculously hard to do, which is so funny because my legs are strong and yet some of the things she gets me to do, I'm like a baby at it. So she is teaching me to be
that's fantastic.
building up muscle that I didn't have in
Yeah.
different parts of my legs.
Well, and that is something that may very well be playing into that knee pain picture. And so again, I think that's excellent. So following up with them and following up with your family doc to have a little bit of a look,
Okay.
because it sounds to me like you've got asymmetrical knee strength.
Yeah.
And that's probably playing into this to a certain degree. So, so those are just some of the suggestions around this. So
Okay.
just to sort of anchor it, when we think about body weight per se, as opposed to health, our body tends to like to stay stable.
Mhm.
Okay, so sort of given this whole preamble and sort of where you're at right now with your mom and things like that, how are you feeling about your body weight and where you're at right now as far as your health goes?
Well, I guess I have in my head, I want to lose 20 pounds. That's what I think all the time. I want to lose 20 pounds.
But are you in a position where you would be willing to do forever what it would take you to get there?
It's like it's like a switch is in my head. When the switch goes on, I can do it.
Mm-hmm.
And then something will happen, like the switch can go on and I lose the weight like before, like something will motivate me, and then I'll go somewhere or get stressed out and the switch turns off.
Mm-hmm.
And then I don't care if it's not on anymore. That's a very good question. Can I do something forever? Just think about that.
Okay.
It's a good challenge.
Well, I want you to reflect on it, and I think it would be worthwhile to sort of just really be mindful because of this whole issue with regards to the curve, right? So, this business of losing fat-free mass, right? And
Yeah.
each time you go down, needing to have fewer calories,
Yeah.
right? You need 1,400 calories to run your brain, your heart, your liver, your kidneys, right?
Yeah.
So when you start going down lower and losing that fat-free mass, you're going to make yourself each time have to work harder to get down there, which is why we say not to do anything you can't do forever.
Yeah, because
So
I would never go that low. I'm not a person who starves and stuff or something.
okay.
And I'm a vegetarian and I eat well. Like I eat
Okay.
a ton of good food.
Okay.
I just sometimes embellish it with things that I wouldn't need to put on. I understand that concept of people who can do that, and I just think, wow,
Mm-hmm.
I don't think I.
Mm-hmm. So I'm sort of going into this whole harm reduction right now, just because
Yeah.
I'm mindful of the situation that you find yourself in,
Yeah.
and certainly your body right now wants to stay stable,
Yeah.
right? So it should be possible for us to navigate this difficult challenge that we have coming up here without
Yeah.
having a lot of weight gain,
Yeah.
which we don't want to have. Okay,
Right.
and
Right.
staying stable is actually an achievement. So on
Yeah.
average, people gain 1 to 2 pounds a year, right? So staying stable is actually an achievement. And then the question becomes whether or not we also never suggest a goal that's a weight. So we usually talk about functional or health goals, something that someone wants to achieve that's not actually a weight goal. So
Yeah.
for example, what you were sharing about your knees and what you've been doing with your physios, well, that's a great goal. You want to have better function of your knees, you're working with a physio, which you're already doing,
Yeah.
and you're already engaged with regards to improving strength, to improve function in the knees, or urinary incontinence, the asthma, those kinds of things.
Right.
Those are all functional things that a person wants to be able to do,
Yeah.
as opposed to a number goal,
Right.
right? So, so sort of given that kind of summary of where you're at right now, you may or may not, want to address any of these kind of elements or not. I mean, one of the things you said to me that was quite striking was that there's this guilt around having perhaps caused your own cancer, which
Right.
I think is a really challenging thing to have to sort of live with. And the evidence around that's not, there was a lot of metabolic things going on in your body at that time that would have been contributing to it. I don't think you should own that the weight was causing that, because that's something which could be very challenging for you.
Yeah.
And that might be something that if it was really bothering you, you might want to explore further. We do have some behavioral health consultants and stuff like that could work with you around that space.
Okay.
But this is kind of the map of where you're at and where you've been, and overall, you're very, very healthy. So,
It makes it feel better than just, like when you think of this whole picture, it starts to make more sense. I think it actually reduces the personal guilt.
Good. Yeah, good. Because in a lot of ways you're doing a lot of great things for your health. You know, you're actively engaged in doing great things for your health. So the question becomes whether there's something else coming out of this that in the short term that you really want to take on, in which case we would do some goal setting.
Okay.
Or whether that's something where you say, you know, maybe my focus will be to stay steady for the time being and maybe engage in that at another point in time, given what you're contending with in your personal life. But there's no drive that you have to do that, but if that's something that you wanted to do, we could.
Yeah.